No Small Endeavor is brought to you by Progressive Insurance. What if comparing car insurance rates was as easy as putting on your favorite podcast? With Progressive, it is. Just visit the Progressive website to quote with all the coverages you want. You'll see Progressive's direct rate, then their tool will provide options from other companies so you can compare. All you need to do is choose the rate and coverage you like. Quote today at Progressive.com to join the over 28 million drivers who trust Progressive. Progressive Casualty Insurance Company and Affiliates. Comparison rates not available in all states or situations. Prices vary based on how you buy. Hello, friends. I'm Lee C. Camp. You're listening to No Small Endeavor. This is our unabridged interview with Dr. Quincy Byrdsong. I remember a few years ago standing in the lobby of our church talking to an acquaintance who was an executive in a healthcare company. He said something about the ways in which they could predict life expectancy, longevity, and health outcomes based upon someone's zip code. I didn't recollect having heard such a thing, and I stopped him and I said, "What?" And he told me more about the ways in which their predictive modeling could tell a great deal about someone's life outcomes based simply upon their zip code. This, of course, raises all manner of questions about justice and equity, who gets access to what and why. And beyond that, it raises questions about how things came to be in such a way. Today's episode raises all of these sorts of questions. What are the variables that relate to how well you will live and how long you will live? And more, how did the contemporary situation in which we find ourselves come to be? Dr. Quincy Byrdsong will raise a lot of these questions with us today, and he'll tell us some of the distressing and troubling stories that lie behind these facts. Here's Dr. Quincy Byrdsong. Dr. Quincy Byrdsong holds bachelor's and master's degrees in biology from Middle Tennessee State University, earned an EDD at Tennessee State University in Nashville, and currently Dr. Byrdsong is Vice Provost for Health Affairs at Lipscomb University in Nashville, Tennessee, which makes him one of my new colleagues. So
yes.
Welcome, Dr. Byrdsong.
Yes, no, thanks for having me.
It's great to have you. And welcome to Lipscomb, and welcome to Token Show.
Glad to be here.
Yeah, grateful to have you. So you've been doing lots of work with regard to public health over the last number of years,
yes,
right?
Yes.
And so when you think about public health, and I know that you've thought a lot about kind of access and justice questions related to public health, what are some of the big concerns or big questions in holding together issues of justice and public health?
Yeah, that's a great question. And in order for me to answer that, I probably need to go back a little bit and give you a little bit of the history of sort of the health inequity.
Yeah.
And so health inequity started with slavery, okay? So the slaves did not have access to health care, at least in the traditional sense. So the only time a slave would be treated for anything is if the slave's health condition, really hindered him or her from being able to do their work as a slave. Mm. So if their arm was broken or they had joint issues and it really hindered them from doing their work as slaves, then they would be taken to be seen by a physician and they would get sort of essentially patched up and then sent out to continue to do their work. Mm. So the thing about this, maintenance and getting checkups, the slaves never had any of that. So that sort of was the foundation for the health inequity. So there were really two times in history where these health inequities were really addressed. Okay, so the first time was Reconstruction right after the Civil War, right? So once the Emancipation Proclamation was ratified and the slaves were freed, there were a whole lot of programs that were now available for the former slaves. So there were clinics that were open for them, access to food, pantries, that kind of thing, access to property. And it was a really concentrated effort to make sure that the former slaves would now have access to, health benefits. The same thing happened with education. So this was the same time when the higher ed institutions were created, the Morehouse colleges, the Tuskegee institutes, that kind of thing, to make sure that now the former slaves had access to education. So that was the first time. Well, the health inequities then sort of went back to during Jim Crow. Health inequities, we saw health inequities again. And then the second time in history where these health inequities were addressed was during the 1960s with the civil rights bills. So now we have more access to healthcare again, more access to treatment, more access to facilities, because during the Civil Rights Bill, now we have, now it's considered unconstitutional to have separate facilities, white, colored. And so now the Civil Rights Bill eradicates that. And then that sort of evened the playing field a little bit as it related to health. Now, fast forward to, 2021. What we're finding now is that these health inequities now, they still exist, but they were hidden a little bit because there's a lot of conflation between race and socioeconomic status, race and education. Mm-hmm. So a lot of what is attributed to race probably should be attributed to socioeconomic status. A lot of things that are attributed to race probably should be attributed to education. But we're having a difficult time, Lee, unpacking those two things.
Right.
But under COVID-19, we were able to start unpackaging those. What we saw, particularly with sort of the incidence of COVID, you were twice as likely to get COVID if you were Black, 1.5 more likely to get COVID if you were of Latino origin. It's just like, hold a second, there may be something here. And then we come to, the vaccines. So in the vaccine trials, the Pfizer trial had, 8% Black participants in the trial. Moderna, similar. And so it's like, wow, we're getting ready to test this vaccine and then distribute it out to the general population when we've only tested on a very small portion of Black and Hispanic individuals. And so this vaccine that we're going to be taking, do we really know how it affects people of color if 80% of your participants were white? So this is what we've sort of run into. Now, what does this have to do with social justice? So let me tie that in. So with social justice historically, that phraseology, social justice, it really started during the Industrial Revolution, right? But it was really more, how do we make sure that the haves and the have-nots have the same access to things? Do they have the same opportunities to pursue the things that they want to in life and able to contribute to the world in the ways that they've been called and purposed to do? But the social justice in the Industrial Revolution was social justice within one race of people. It did not include women. It did not include people of color. So now when you talk about social justice in 2021, now we're talking about how does everyone get opportunities?
Equal opportunity.
Yeah. Equal opportunity. Now it's more about human rights, right? It's more about, how do, regardless of gender, regardless of race, regardless of socioeconomic status, regardless of physical ability. Now social justice is how does everyone get access to those things? But if you think about some of our main social justice issues, it's voting is a big one, education, and one of the biggest social justice issues happens to be healthcare, right? Because of the health inequities that I just brought out. So these things are they're very much related and they're intertwined. We feel like if we can address some of the social justice issues, we may be able to address some of the health inequity issues and vice versa.
Fascinating. Thank you for that. That's a very helpful overview. So I know that one area that you've done a lot of research on that I presume, and we'll kind of circle back around to this in a moment after we talk about it, but that I presume relates to perceptions of authority and perceptions of public health, is the infamous case of the Tuskegee syphilis syphilis study. So could you give us just a brief overview of that case?
Sure.
And what happened in that episode?
So Lee, this is the perfect example of when health equity and social justice collided. Perfect example. So during the late 1920s, syphilis was, it was ravaging, particularly the Deep South, particularly in Macon County, Alabama, which was where the highest prevalence of. We're talking about close to 40%.
Wow.
Were syphilitic. So you just think of that visual, right, Lee?
Yeah.
Every 10 people in this county, 4 of them were syphilitic.
Wow.
So there were a lot of people that were concerned about that, and it was a health inequity because it was disproportionately affecting. You think of Macon County, Alabama during the 1920s and 30s. We're talking about 87% black, right? So we're talking about a predominantly black county.
And Macon is where Tuskegee is. Right?
Tuskegee is one of the cities in Macon County, Alabama. Yeah. So it was a health inequity, and so everyone was like, "Yeah, we gotta address this." So we had philanthropists, one in particular, Julian Rosenwald, who was a contemporary of Booker T. Washington, who had actually funded a lot of the early universities for black people to attend. So he dove right into this. And so he funded a treatment program in Macon County, Alabama to treat the syphilitic individuals. A lot of money was put into this project.
And this is well before the use of penicillin.
Yes, penicillin had not even been discovered at this point. So we're talking about early 1930s. So now we're seeping into the Great Depression, and the money dried up, even for a philanthropist like Julian Rosenwald, who was one of the founders of Sears and Roebuck. He's a very, very wealthy man, but even for him, the money started to dry up. So what the physicians in these treatment programs did, they convinced the Macon County treatment program patients that they are going to come in and continue the treatment program. But in actuality, what they were doing, they were following these individuals without treating them.
Which is, it's just sort of overwhelming to realize.
And they told him that, hey, we're going to continue to treat you all, And so the individual was like, wow, this is great. They're coming in here.
So it's a promise of free health care to a group of people that generally wouldn't have good access to health care.
It was free health care. In some cases, it was free room and board because they would stay in the facility. This was a sweet. And then you're part of something really special. You're part of this. You're part of this treatment program. The federal government was funding this effort, but they were being lied to. So a very, very responsible situation of addressing the health inequity turn it up into a violation of social justice, because now they're lying to this group of people. These individuals think that they're being treated for syphilis, when in actuality they are being followed untreated. They have no intention to treat these individuals. This went on for 40 years.
Yeah, the fact that it went on for 40 years is another just mind-boggling reality about that case.
Yeah.
I was just reading a little bit about this. So the potential symptoms or outcomes of syphilis could be blindness, deafness, mental illness, heart disease, bone deterioration, collapse of central nervous system, and death, as well as infection of others if untreated, right? And I think I read that there were something like quite a few of the study group died. Was it around 400 people that were involved, or what were the numbers of people that were involved?
Yeah, so we had, there were 300 subjects, more or less, 290 somewhere, and then there were 100 controls.
Okay.
Yeah, so it's 400 total.
Okay. And then there was some number that died directly from syphilis.
Yeah, so the number that was, the number that died or either was permanently disabled, we're talking about, half of that experimental group, more than half.
Mm. And then I think I read also that they had at least 40 cases in which wives were contracted syphilis, and then maybe 19 children who were born with congenital syphilis as well.
Yes,
from this group. And then once penicillin became available as a very effective treatment, right, in the 1940s?
Right, about 1945-ish. Yeah.
And then they simply were not offered this either.
Yeah, so the study personnel went out of their way to make sure that they did not get penicillin. So a couple of things that they did to ensure that. So penicillin was given to the military. Anybody in the military that contracted syphilis would get penicillin. So they did not let anyone in this project enlist in the military. And also the draft commission was given a list of these individuals that none of them could even be drafted. So they wouldn't through great lengths to make sure that this population did not get treated with penicillin. And then also the study personnel, because the treatment programs started to revitalize in the 1950s because we had penicillin. So if ever the study staff saw any of these individuals trying to access these treatment programs, they would pull them out of line, or they would contact a physician and say, no, this individual is part of a special effort funded by the federal government. You can't give them penicillin. So it was great lengths were really, they took great lengths to make sure that these individuals did not get treated.
A widespread systemic issue, right? Not just one or two players here, but
yeah, they involved the physicians in Macon County. Many of those physicians were physicians of color. They involved a community health nurse as one of the main people that coordinated it, who they knew that these individuals would trust completely. She was also a graduate of Tuskegee. Wow. And so they really, really, for lack of a better word, they really exploited her relationship to these individuals, to this community, to make sure that this, it essentially allowed it to go on for those 40 years.
Was she also aware of what was really happening?
She knew something was wrong. And, but you got to understand, this is a Black female that's under the supervision of, people that are being funded by the government. She didn't have a lot of, she didn't have a lot of influence in terms of, getting it turned in the right direction. But when it was all said and done, she was one of the people that really, was able to describe what was going on and what had been happening to these individuals over time. And, and our very own Fred Gray, he was the attorney that ended up representing the families in this study.
Yeah. And then that case, they won a $10 million verdict, I think.
$10 million.
Against the federal government.
Yeah, this lawsuit was $1 billion, but they settled for 10.
And then there was an apology, I think, from Bill Clinton.
Apology from Bill Clinton.
Yeah, to the participants.
Yeah.
I also read a report that indicated, so we've already pointed to the ways in which race was involved here, in which poverty was involved, but also apparently illiteracy was involved. And at least one or two of the people involved indicated that the illiteracy of the subjects allowed them to continue to do what they were doing because they couldn't read the newspapers, or they couldn't know what was going on in the larger world, and thus were easier to exploit.
Yeah, and the thing about it is these individuals were educated, but not in the traditional sense that we think of someone being educated. They were they were industrious. They were, agriculturally trained. They were making a living for their families, but not, they didn't have a lot of excess, right?
Right.
So the fine print, even if they were able to understand it, it wouldn't have really mattered because, they were being offered something that was pretty substantial, free food, free room and board. And another incentive, which is not as commonly known, is they would have their burial service completely paid for by the study. So if you think about it, syphilis had been pretty much understood as a death sentence for people. You were going to die of syphilis if you got it in the 20s and 30s because the treatment for syphilis back then was like arsenic and mercury, all these really, really toxic things that probably did as much damage to the body as syphilis did. And so, pretty much if you had syphilis, you would die with syphilis. But to offer these families, we'll pay for your funeral. That was like a big deal.
Yeah.
You can now have, a nice funeral for your loved one. And so that was a very, very attractive incentive for these families as well. They would have a free funeral. And, and you think about the kinds of funerals that they, were able to have without this resource. It wasn't the kind of funeral that, that's very, dignified. Yeah. And so to say that, we'll pay for it, it's like, wow, that's, we get to bury our loved one now and with even to some degree with dignity and respect that they didn't even get when they were alive. So that was a huge incentive.
And I think part of that so-called incentive then allowed the government to have control over autopsies of the bodies after
everything.
death. Yeah.
They had control over everything. And that was where they got a lot of their data. And so here's the thing with human subjects research that they get you, right? Something is not ethical or unethical because of the information you get. It's either ethical or unethical when you start the study.
Mm-hmm.
And even though we learned a lot about syphilis during this time, I mean, how we got the information is completely unethical. If you think about the Willowbrook Hospital in New York, right? They injected in these mentally disabled kids. They injected hepatitis into them. But Lee, that was the study that gave us all the information that we know about hepatitis. That it was that study that gave us the two main strains, hepatitis A, hepatitis B. We learned it from being unethically treating mentally disabled children. That's how we got the information about hepatitis. So you think about that, and you think about what we do in ethics and, in Christian education, the ends in this case, never, justified the means.
Yeah. And we have this sort of stuff going on precisely at the time the Nazis are doing some of the most horrific sorts of examples of this.
Oh yeah.
And I guess it's yet another episode or episodes in American history where it's much harder to look at your own government, perhaps, and acknowledge, this sort of grave injustice and deception is occurring, because we don't want any sort of moral equivalency with the sorts of experimentations that the Nazis might have been doing.
Yeah, well, and it's interesting that you say that because, during the time of the concentration camp experiments, we were doing experiments on our own citizens here.
Yeah.
The Manhattan Project. We exposed thousands of people to radiation because we knew that nuclear warfare was going to be the thing during World War II. So we did radiation experiments. We did radiation experiments on kids. During all of the things that we indicted this so-called depraved regime of Nazis, everything we indicted them for in the United States, we were doing to our own citizens.
Yeah, in terms of the medical experimentation.
In terms of medical experimentation, we were doing the exact. But here's the thing: when the Nazi physicians were during the doctor's trial, right, Nuremberg, they said that we were doing this to protect our military, and we said, no, you can't do that to protect your military. But when we were questioned here, while we were doing that to our citizens, guess what our response was? It was to protect our military. Right? So it's okay for us to do it to protect our military, but Germany, they can't do it to protect their military.
Yeah.
And then the whole thing about the nuclear warfare, who was the only country that dropped a nuclear bomb?
Yes.
So everything that we were trying to keep them from doing, we ended up doing. Yeah. So that's probably another show.
It is another show. It is another show, but I'm flashing back to one time when I was working on a particular book and I was sitting in a office of a dean at a university in Istanbul with a number of Muslim scholars from different disciplines, and we were talking about rules of war. And at one point, we were talking about weapons of mass destruction, and one of the Muslim scholars bristled and he said, "Look, we know the only country that's ever dropped an atom bomb on civilian populations." And again, a sobering sort of moment. Yeah.
Yes. And another study I just want to just remind you of, and you probably know about this as well. So also during this time, there was a malaria project here during around the same time. And what we did was we injected prisoners with malaria. It was called the Stateville Penitentiary Malaria Project.
Was that Ohio?
Ohio, yes. Yeah. And we injected malaria into prisoners, and we said that if you allow yourself to be injected with malaria, you could actually reduce your prison time.
Oh my Lord!
Yeah, and this study went on for many years as well. And this is so.
What was the time frame of that study?
So it was so we're talking about late 30s to mid 40s, around the same time that the
Tuskegee study
the syphilis study, and the same time of the concentration camp. So it was like, you had all this stuff going on. You had all these things that were going on in the United States that were going on sort of parallel with what was going on in the concentration camps in Germany. But for some reason, it was justified because of how we as a country felt about who was important and who wasn't. So it's okay to do an experiment on a prisoner. They're the dregs of society. So it's okay to do experiments on people of color because, they're not real citizens anyway. That was sort of the mindset.
Right.
Now, it was bad for Nazi Germany to do it, but for some reason, we were okay with doing it here. And tying this back to what we're talking about with social justice, right? What social justice really comes down to, who's important, who's not important. And social justice plays out based on that premise, right? So if there's a certain population that as a society we don't feel as important, then we can do things to them, differently than a part of society that we think is important. And
Right.
Healthcare is the same way, right? So I'm gonna give you just a really, this example to sort of bring this home. So my wife was being seen at a hospital where I was a vice president. And so she was, I was in my office, she was being seen in one of the rooms. And, so, I leave my office, I'm going to check on her. And so I go, and she's just sitting in a room. I said, has anybody come in here to see you? Like, no. I was like, wow, you've been in here for a really long time. She's like, no one's come in and check on me, nothing. So I walk out into the hallway, and then one of the physicians sees me. He says, hey, Dr. Byrdsong, how are you? I was like, oh yeah, I'm good. Just, just working hard, blah, blah, blah. And he was like, was there anything I can do for you? And I said, no, I'm just coming here to check on my wife. And he was like, well, who's your wife? So then I point to the room where my wife has just been sitting there. No one checking on her. Now, all of a sudden, all hands on deck.
Yeah.
He goes in and check on her. He finds out what nurse is assigned her room, blah, blah, blah. Now, why do I bring this up? Because it becomes an issue of who's important and who's not.
Right.
Now, all of a sudden, my wife is important. And now I'm going to treat her because now I realize that her husband is an executive at this hospital where I work.
Yeah.
And so why did I have to come there and make my presence known for my wife to be considered important? And so that's sort of what we're dealing with when we talk about social justice.
Yeah. So let's fast forward to the last year and a half.
Sure.
How do you see this history, these various historical episodes playing into what's happened with the pandemic, with populations of color in the United States, and either access or I would assume we also have issues of misinformation, distrust, potential distrust. Seems like all of a sudden it gets really messy by the time you get to something like a global pandemic, where you have federal authorities saying these are the things that we need to do. So what are things that have been observed and noted that have played out in the last 18 months?
Yeah, so the health inequities that I described that have their roots all the way back to slavery, the pandemic exposed them even further. So here's how it exposed them. In the hospitals, we saw the people that were being treated for COVID-19. You would look in some rooms and the entire room would be of one race ethnic group. Mm. It's like, wow. Now, there's no biological reason why, it's not like a Black person or a Latino person has something genetically wrong with them where they're more likely to get COVID-19. So why is it that we saw, such a disparity? Then we were able to tie in other factors. The health of those communities. What was one of the number one predictors of mortality in COVID-19?
Whether you had comorbidities, right?
Comorbidities. And then what was the second one? Obesity. Mm. So now we have to think about people of color are disproportionately more obese than not people of color. Why is that? So then you have to go back even further. Why? What? So then you have to tie in things like social economics and education, right?
Mm-hmm.
Now, 50, 60 years ago, so here it's all of this ties in. 50, 60 years ago, you could really tie in race to socioeconomic and education. But now it's harder to do that because now people of color are more educated and have more money than they've ever had. Huh. So now you can't say racial minority and underserved. Now you can't say those in the same breath in the same way you could 50 or 60 years ago.
The overlap is not as significant.
The overlap is not
significant.
You know, 50, 60 years ago, if you were a person of color, you probably were not educated and you probably did not have. Mm-hmm. But you can't say that now. And if you were to say that now, that would be a very racist thing to say. Right, yeah. So for me to say, okay, you know, I'm educated and I have means, and for someone to say, well, you don't represent black people. Lee, how racist is that?
Right.
Because I'm educated and have money, I can't represent black people. I mean, just think about how racist of a statement that would be. So, but at any rate, so when you tie all this stuff in together, all of this came out during COVID-19. We saw disproportionate, cases, disproportionate hospitalizations, disproportionate mortality. And then when the vaccines happened, we saw a different health inequity, didn't we? We saw a health inequity as related to socioeconomic class. So the highest predictor of who got the vaccine during the first 3 months of the vaccine was not race. It was socioeconomic status. Mm-hmm. If you had money,
you got it.
And what we saw is, there was this priority that the states developed that no state followed. So the priority was, frontline healthcare workers, elderly. That was a priority, but that's not who got it. The people who got it were people that had connections, people that had money. So whereas you had hospitals who didn't vaccinate their frontline workers first, they vaccinated their C-suite first, their CEO, their CFO, their development officer. That's who got vaccinated first. And then they vaccinated their frontline workers. But they did it under the auspices of, well, we want to set the example.
Yeah.
But I mean, no, you don't have to do that to set the example.
Yeah.
Get the vaccine to the people that are more exposed. I mean, you were vaccinating people that hadn't been in the office in months.
Yeah.
You were vaccinating people that did not have to ever expose themselves. Frontline workers, they didn't have that luxury.
I was surprised about how I would overhear conversations where I realized if I chose to go out here and jump the line, I have access. I could do that.
Sure do.
And it was important for me to wait my turn, which I did.
Yeah,
but it was really surprising to me to see how many opportunities there would have been for me to jump line because because I'm reasonably connected in this town and
absolutely,
and so it was fascinating to see how.
And that was the reason why. I mean, I did the same thing, Lee. I didn't jump line and I was like, well, you can go over here and get. I'm like, so it's not my turn. If I get vaccinated, then I'm taking the vaccine out of the arm of somebody else. I said, it's not my turn. I said, when it's my turn, I'll go. But no, I can't. I'm not going to go just because I know, such and such over at such and such.
Right.
And Lee, you think, but I'm the vice provost of health affairs for a university. I could have gotten the vaccine, and I could have been the very first group of people that got it.
Yeah,
but I was like, that's not right. It's not my turn. I'm not in that. I'm not a frontline healthcare worker, and I can work from home. I can do what I do from home.
Yeah,
So I don't have to expose myself to COVID. No, these frontline workers, the people that clean our buildings,
right?
They can't. They don't have that luxury. You can't be a custodial worker and work from home.
Yeah.
So I want them to get it because they don't have the luxury that I have of being able to work from home if I need to.
Yeah.
So
what are some of the other things that have been exposed over the last 18 months or so?
So we've been exposed, Lee, in two ways. We've been exposed in a good way. So let me tell you the good ways we've been exposed. Our ability to develop a vaccine this quickly.
You're right. It is amazing. It's astonishing.
Unprecedented. There's never been a vaccine developed this quickly in the history of the world. So we're exposed in the sense of, gosh, we can really, if we need to, we can put together a vaccine that'll at least reduce the spread of a pandemic pretty quickly. So we were exposed there. We were exposed to how well our emergency preparedness was. It's particularly in this state. I mean, we were able to just go right into gear. And just, sort of mobilize the troops, if you will. I mean, we were able to do that. I mean, and we had no idea, I think, how well we were prepared for our pandemic. So those are some of the good ways we were also exposed on how good our technology is. All the things that we were able to do, not just with the vaccine development, but how we were able to use other types of medical procedures, how we were able to be creative with ventilation machines, ECMOs, other types of medical procedures, and we just sort of put them into place. Air filtration technology, all this kind of stuff. Where we were exposed in the bad way is, number one, sort of the health inequities. That was the big thing we were exposed. We were also exposed in how hard it is to make people do things. Like, a la the mask.
Mm-hmm.
We thought that we would just say, hey, you got to wear a mask. It didn't work like that. And people that didn't want to wear a mask were very, adamant about not wearing the mask. And there was really nothing that we could do to really enforce that mandate. I mean, we had mandates and said you would get fined and all that kind of stuff, but it was very, very inconsistently enforced. So we were exposed there. And then we were exposed, back to the health inequity thing, we were exposed a lot about who we thought were important and who we thought were not important, because we saw so many differences in who got treatment, who got the vaccine. It was like, wow, we've come really, really far. There's still an issue in this country of who's considered important and who's not.
So you've been doing this kind of work for decades now.
Yeah.
And so a personal question, if I may.
Absolutely.
How do you, as an African-American man dealing with these issues, I guess I kind of got a two-part question.
Okay.
How do you, first is, how do you navigate what I would speculate or sort of natural human emotions of anger, potentially resentment or bitterness, in realizing wave of injustice? How what's that been like for you?
It's been really, really challenging for me. Particularly in my career, professionally, it's been challenging. I still realize that my industry is not really comfortable with people that look like me in positions that I'm in. There's a comfort level. The comfort level is attached to racism. And so let me give you what my definition of racism so you can, operational definition for our talk, right? Racism is not, it's a mentality. It's the feeling that everyone in a race has similar characteristics, and these similar characteristics determine what race is superior to another. So that's how I define racism. So it's what you think about people, not necessarily what you do, because you can be a racist without doing racist things. Okay?
So a presumption of a sort of supremacy of some sort of one group over the other.
That's it. That, to me, that's what racism is. So kind of connect that to me, people not being comfortable with me. They're not comfortable with me in these positions because of the racist ideology that the race that I represent, the black race, is inferior to the white race. Which by default means that I can't be in a position like I'm in now because my race is inferior, not Quincy Byrdsong.
Right.
But the race I represent is inferior. Yeah. So there's a comfort level there, and I have to deal with it. So what ends up happening is I have to be better to be looked at as equal. And this is something my dad taught me when I was really, really young. He used to tell me, Quincy, it's not just enough for you to be, to perform at the same level. You had to perform at a better level to be considered even on the same level because of the notion that I start out inferior. So two of us are there. You're superior, I'm inferior. So we're starting out there. So I have to get from the starting position of inferior to something, closer to what society would think of as where you are, even for the competition to start. In order for me to beat you in that competition, I can't be where you are. I had to actually be better because I've already had to start out from a position of inferiority to begin with. Not that I actually am inferior,
right?
But I'm perceived as such. So yeah, it's been a challenge. And in terms of the anger.
So, but let me just have, so this was something that your father was explicit with you about as a young man.
Explicit with me. I mean, he went through the same challenges. I mean, he was not able to teach. He was a college professor. He wasn't able to teach at predominantly white institutions. During that time, Black people in the academy, they were really restricted to teaching historically Black colleges and universities. They couldn't bring. My dad didn't have the same opportunities I've had. I've worked at Vanderbilt and VCU and now at Lipscomb. So I mean, he would have, back in his day, he would have never had those opportunities. And it's there are opportunities that we have now that I don't take lightly because I know that people before me. I mean, I stand on their shoulders, and I don't think that I don't think that a lot of people that get these opportunities understand what people were denied. For me, I mean, my dad, Lee, lived in a county that the high school in the county didn't even let Black students attend. So he was raised in a society that was designed for him to be a permanent underclass. 8th grade education was the best he could do.
Wow.
So.
And then to go on and be a college professor.
Well, he didn't accept that as his reality. He said, well, okay, there's got to be a high school somewhere,
right,
that lets Black people go. And so he went to a different county, got up at the crack of dawn, and got on a bus or a train or whatever it was. Went to this other county that allowed Black people to go. He ended up being the first person in his city to graduate from high school. So we're not talking about first generation college.
Wow.
We're talking about first generation high school. But he said, that's not going to be my reality. This society is set up for me to be a permanent underclass, but I don't receive that.
Yeah.
And so he goes there, and then he ends up going to Fisk University right here in Nashville, Tennessee. Becomes a college professor, had a 40-something, career.
Wow.
In the academy, and
what was his discipline?
English. And retired as a very, very well respected academician. And all those things, but he did it. He did it in spite,
right,
of what was stacked against him. And so,
he certainly was speaking out of his own experience when he was giving you this advice.
Lee, he was saying, Quincy, you don't have any excuse.
Yeah.
I mean, he said, look at what I had to go through just to get anything. And so, he didn't really leave a lot of room for me to make excuses for not being everything that I could be. So.
Yeah.
But you asked the question about the anger, so I do need to talk about that. So I don't, it doesn't, it's frustrating, but it doesn't anger me because anger is what society expects to be my response. And if I respond to things in an angry way, I'm actually feeding into sort of the narrative about what my race represents. So, to me, the proof is in what I do. So I perform, and I let that do the talking. Everything that I do, I'll do my best to be, not just excellent but elite. And the predictive index, whatever it's called, the strength finders. So I'm a maximizer. So one of the things that I do is if something's good, I want it to be great. If it's great, I want it to be excellent. If it's excellent, I want it to be elite. So if I take on a project and I don't think I can make it elite, I'll say, well, I'll probably need to move to the next project. And so, but yeah, I do my talking that way. I don't express it with anger. In my entire career, I've never pulled the race card ever. And if a door's closing me because of race, I don't get angry. I just know that that's God's way of telling me that there's another door for me to go. And I'm going to be where God calls me to be. And that's going to be enough. And it's played out for me well throughout my career, by the grace of God. But yeah, it's frustrating more than making me angry. Mm-hmm. We if I respond in that way, then all people will see is the anger, and they don't really see what else I bring to the table. Mm. So I don't really, if I'm going to be angry, I could be angry in my own little personal, my own little personal way of processing, right. What's going on around me. But it's a lot out there, Lee. Mm. But I got to say this. I mean, I'm very blessed and fortunate, in spite of, of what's going on. And I do my best to let, Black males that are younger than me, I make sure that I encourage them, and I make sure that they see me. Hmm. They need to see me and what I'm able to accomplish, and they need to know that they're not a thug. They're not a thug. They're not a criminal. They're not a slacker. They're a king. Hmm. And that's what I tell them, and that's what they need to hear. And then also, my young white males need to see me too. Mm-hmm. And I know that's not something that you hear a lot. The young white males need to see me just as much as the young Black males, because
that makes lots of sense to me.
Because because the media has created really only two Black males the media shares with you. And they're at the two extremes. All right, so the media has shared with us the lower extreme, the thug, the criminal, the shiftless, the lazy. Media gives you a lot of examples of that. Most of the time when you see Black male on the news is because they've committed a crime. So they're framing that. But then there's the other extreme. There's the exceptional. There's the Oprah Winfrey, Barack Obama, LeBron James. So the media gives you either one or two extremes. So when you see me, Lee, you have to decide which extreme is Quincy Byrdsong. Unfortunately, some of our young Black males get tagged with the other extreme, mm-hmm. the criminal thug, the lazy, shiftless. And very seldom are they seen defaultly as the Barack Obama, LeBron, mm-hmm. right? Unless they're excelling in some sort of sport or something like that. But if just, first glance, it's like, okay, which one? Which one are they? So that's why, the young white males need to see me. And I don't know what category that they would defaultly put me in, but they need to see me like, hey, this is a Black male that has carved out his place in the world. He's passionate about what he does. He loves what he does. He's good at what he does. They need to see me just as much as the Black males, because they need to know that there's not just two Black men that exist, the criminal or the president of the United States. There are Black people that are achieving in many, many ways. My brother is a judge in the largest court in Los Angeles. Mm. So, I mean, it's, we're not freak accidents, right?
Right.
We had a dad that was telling us that we were a king, but we had a society that was telling us that we were a criminal. Mm. So it came down to who do I want to listen to? Do I want to listen to the people that are telling me that I'm a king, that I can be anything that I want to be? Or do I want to listen to society telling me that you're destined to be a criminal? Mm. You're destined to be dead by the time you're 21. Mm. So it just comes down to a matter of who, we're willing to listen to. And then we become a product of our expectations. So you can go to my neighborhood and then you can see me, you can see my brother's a judge, you can see bank presidents. This is in my community I grew up in. But then you also see the people that are in jail right now. Mm. You see the people that were killed in criminal activity. So you see both. So, this notion of, your environment dictates what you do. Well, that's ridiculous. How could two sets of people in the same neighborhood have such drastically different outcomes? Mm. Can't be the environment, because we grew up in the same environment. These people I'm telling you about, they're in jail right now. We used to play, football in the front yard together. Our family situation was similar. These are 2-parent households. I had a 2-parent. But there were some people that said, hey, I'm buying into what society thinks I am, and they went down that path. I decided to go down the path of, hey, I can be anything that I want to be. And so the more that our younger generation sees that there are paths that you can take in spite of sort of the things that are going on with injustice, you can still do things in spite of that. So
here in Nashville, thanks so much for the wonderful conversation.
Oh, thank you, Lee, for having me. This
great to have you as a colleague now.
Yes, it's been a good time. Thanks.
Our thanks to all the stellar team that makes this show possible. Christy Bragg, Jacob Lewis, Sophie Byard, Tom Anderson, Kate Hayes, Mary Evelyn Brown, Carriet Harmon, Jason Sheasley, Ellis Osborne, and Tim Lauer. Thanks for listening, and let's keep exploring what it means to live a good life together. No Small Endeavor is a production of PRX, Tokens Media LLC, and
Great Feeling Studio.